So let us look at each of these models and see what they mean and how we can use them. Biomedical model of health. This one, it looks at the physical and biological aspects of health. So if you get, let us say, you feel headache, you have headache, you have fever, you have joint pains. So the most likely thing is that you go to the hospital and you anticipate that you have malaria. When you reach the hospital, the doctor will take your history and send you to the lab to get your blood tested for malaria parasites. And when the result is actually positive, you come back, the doctor will give you anti-malarial drugs and you'll go home, and that is it. So in biomedical model of health, the doctor is actually looking for what is that thing that is disturbing your physiology, whether it is your physiology or an anatomical problem that you are having. That's what the doctor is looking at. So he's looking at the way your body works, that is the biological aspect, and also is looking at the physical aspect. Okay, he's looking at you when the person is actually examining you. Will be looking for whether you are pale, your skin is okay, whatever it is. These are physical aspects that they're looking at to give you a diagnosis. And when they have treated you, that's it. That is the biomedical model of health. So they are not going to look at why did you get malaria. No, that is not their concern, because they are looking at you physically and how your body is working. That is the biomedical model. So they are looking at what is causing the problem and treating it, and that's that. So this is what happens in clinical medicine and all the services that we get in hospitals or health facilities. Okay, so getting history, getting the workout, these tests, laboratory tests or imaging interventions or investigations that are done, you're given a drug, or you're taken to the theater for surgical procedures. That is it. That is biomedical. Now, yes, this model is very important in helping individuals get treated if they have diseases. That's good. And for us in public health, we can, just a moment. So we are basically saying that if you have very good healthcare services, people are going to be treated. Their conditions are going to be identified and they will be treated and they will go home when they are well, when they have recovered. But the challenge is that this model does not look at the root causes of these problems. Okay? So this model only focuses on what is the disease. And that's it. If they identify the disease, then they will decide whether it is a medical condition or a surgical condition. And then it is handled, and that's it. Okay, so that's the limitation. Now we come to the biopsychosocial model. Now this one incorporates what we have looked at, the physical and the biological aspects that we have just looked at. It is in this bio part, that component, which is here. The physical, your physical health, the fact that you have different individuals who have different genetic vulnerabilities, and also people are generally different. They are not the same. We have genetic predisposition, or what we are terming as genetic vulnerabilities here. So this model recognizes that, yes, these biological aspects are very important, but also we need to look at social aspects as well as the psychological aspects. So when someone has malaria, that malaria will affect the physical health and it will be treated. Okay, so that is the biological aspect here. And then that person again who has this malaria, we are going to look at what is happening at this person's home. This person is staying with who? Okay, this person is staying with who? And if we know whether this person is staying with somebody or not, we can be able to make conclusions about why this person actually got this malaria. Because one, if this person is a child and is not having an adult around, um, there is no way this child can understand that sleeping under a mosquito net is very important. Or even recognizing that, you see, uh, this person is staying alone and is a child, or is staying in what we call a child-led family. They may not even be having the money to buy the mosquito net. So when we treat the malaria, this person will get the malaria again. But if we send a social worker to their home and the person assesses and says, okay, there is a lot of stagnant water, there are broken bottles, there are a lot of bushes, the window is always open, there's no mosquito net, that is social. Those are social aspects. There is a bit of because social health also includes actually environmental issues. Okay, so the family circumstances, the family networks, social relationships, family relationships, all these are social, so they play an important role. And then psychological, again, you can see the intersection that psychological well-being is also affected by physical health. Before we move into psychological concepts to do with coping mechanisms, self-esteem, and all these other things, you can also say that psychological well-being is also affected by physical health. Okay, so those are the three components that we have here. So we can look at each of them in this description. So biological factors, here we are looking at how your body works, how the body of an individual works. So we are looking at physiological processes, and functions. But it also looks at individual aspects to do with genetic predisposition. That you have some people who are likely to get some diseases because of their genetic makeup, but also physical health is also an important determinant here. Okay, so biological factors, we look at physiological aspects, we look at genetic predisposition, we look at biological agents that cause diseases, whether viruses, bacteria, and other microbes that can alter the way the body works. Okay, so when we come to the psychological factors, we look at mental and emotional factors that influence health. Okay, The ability to manage your emotions, your beliefs, and your thoughts are very important in shaping your health. Stressed individuals are likely to have conditions like hypertension, ulcers, and others. Social well-being. If you get sick, who can come and visit you? Okay. If you are admitted in the hospital and no one comes to visit you, there is a very big problem to do with your social networks, social support, social relations. Some people actually need a lot of social support compared to, let us say, a medical condition, the medical condition that they are having, or the medical care that they are given that we described earlier on. Uh, they they need some people actually get sick because of social isolation. They don't have the support network that they are supposed to be having. Okay, so if someone has a good social support network, then they are likely to pull through uh, when they are sick. So that's the point, that you can have a minor health condition, but that health condition can actually worsen because you are actually alone. So even if you get the medical care that you need without the social support, then you'll be in problems. Okay, so social support, access to healthcare, community, connectedness, cultural briefs. Uh, these are some of the aspects that we can talk about there. So what does this biopsychosocial model basically tell us? One is that when we look at an individual, we do not only look at that person in isolation, we need to look at that person holistically. Okay, so we take into consideration the biological aspects, what is happening with this person as far as their physical health is concerned. We also look at what are the circumstances around this patient. Okay, that's when we look at the social factors, and then we also look at the psychological well-being. So that is the holistic perspective, that we do not only look at the physical and biological angle. And then when we apply holistic care or holistic perspective, then we are likely to involve the patient more in their own care, and we are not basically prescribing the care that we believe is what the patient desires. We involve the patient more in the decision making process and understanding the patient, and having a listening ear to understand what is going on with the patient. And that is the concept to do with um, patient-centered care. Okay, if you have two patients who are having a particular health condition, you're not going to give them the same kind of care because the circumstances may not be the same. And that is where personalized care comes in, that the care has to be tailored to individual preferences and circumstances. And then it also emphasizes that, you see, we need to look at prevention keenly. Okay, so what are those factors that contribute to the person's illness? Are they the genetic predisposition or individual factors, sex, gender, which sex or gender basically, or is it genetic factors or any other factors, social, environmental, and many other aspects? It also teaches us to work collaboratively with the other professionals. Like you had in my discussion of social a social worker. Okay, if you look at social well-being, you will need a social worker. If you look at counseling for psychological support, you need a counselor. If you need, you will need a doctor for um, prescribing the medication that this patient will receive, or even surgical interventions if they will be the ones to be given. And then you will have a pharmacist to basically dispense the drugs that the patient will want. And then you need also public health professionals to do issues to do with health promotion and preventive interventions. So that is interdisciplinary collaboration. You don't work alone. And then the last part is that um, it also teaches us that, you see, health is a complex issue. It is affected by multiple factors. That's what we are meaning by multifaceted issue. You have many factors influencing health. Okay, so it means that um, you can have individuals who can have some resemblance but still having different health outcomes. And this could be because of biological factors, social factors, environmental factors, whatever, many factors. So health is a complex matter.